Ever wondered what the difference between Medicare and Medicaid is? Both are government-sponsored programs aimed at making healthcare affordable. However, they're not one and the same. Medicare primarily serves the elderly and those with certain disabilities, while Medicaid targets low-income individuals and families. They differ in eligibility criteria, coverage, costs, funding, and even enrollment procedures. So it's not a case of one-size-fits-all when it comes to these healthcare programs. Let's dive into these differences to understand these programs better. Firstly, who do these programs serve? Medicare is primarily designed for individuals age 65 and older, along with younger people who have certain disabilities or conditions like end-stage renal disease or amyotrophic lateral sclerosis. On the other hand, Medicaid services low-income individuals and families, encompassing a broad range of groups like low-income adults, children, pregnant women, elderly adults, and people with disabilities. So while Medicare primarily serves the elderly and disabled, Medicaid is for low-income individuals and families. How does one qualify for these programs and what do they cover? Let's untangle this. For Medicare, eligibility is primarily age-based, focusing on individuals age 65 and older, along with younger folks with certain disabilities or specific conditions like end-stage renal disease or amyotrophic lateral sclerosis. Income doesn't affect Medicare eligibility, although higher income beneficiaries may pay higher premiums. On the other hand, Medicaid is income-based, catering to low-income individuals and families. The specifics of eligibility can vary by state, as states have significant leeway in administering the program. Now, on to coverage. Medicare is split into parts. Part A covers hospital stays and some home health care, while Part B takes care of certain doctor's services and preventive services. Part D is all about prescription drug costs. And then there's Medicare Advantage, an alternative that often includes additional benefits and may include Part D coverage. Medicaid, meanwhile, provides a broad level of health insurance coverage, including doctor visits, hospital expenses, and even benefits not typically covered by Medicare, like dental services. So while eligibility for Medicare is largely age-based, Medicaid is income-based, and both provide a range of healthcare services. What about the costs associated with these programs and their funding? Let's delve into the nitty-gritty. Medicare, as an insurance program, does require beneficiaries to contribute towards the cost of their care. This contribution comes in the form of premiums for some types of coverage and deductibles and co-payments for most services. However, there's a silver lining for lower-income beneficiaries, as they may receive assistance to help offset these costs. Now let's talk about Medicaid. Often, Medicaid beneficiaries have no premium or a very low one and minimal, if any, co-payments for the services covered. However, it's important to note that states have the discretion to impose some out-of-pocket costs. So, where does the money for these programs come from? Medicare is primarily funded through payroll taxes under the Federal Insurance Contributions Act, commonly known as FICA. Beneficiaries' premiums also play a crucial role in funding the program. Medicaid, on the other hand, is a joint venture funded by both the federal government and the states. The federal government matches state spending on Medicaid based on a formula known as the Federal Medical Assistance Percentage. In essence, both programs aim to make healthcare accessible and affordable, but they do so in different ways, reflecting the different populations they serve. Medicare requires premiums and co-payments and is primarily funded by payroll taxes and premiums, while Medicaid often has minimal costs to beneficiaries and is jointly funded by federal and state governments. Now, how does one enroll in these programs? For Medicare, when most people reach the age of 65, enrollment is typically automatic, especially for those already receiving Social Security benefits. However, if not, they may need to enroll manually. On the other hand, Medicaid enrollment requires a bit more legwork. Eligible individuals must apply, and this can be done through state Medicaid agencies or healthcare marketplaces. Importantly, Medicaid offers the flexibility of year-round enrollment. Enrollment in Medicare is often automatic at 65, while Medicaid requires an application through state agencies or healthcare marketplaces. Let's recap the main differences between Medicare and Medicaid. Medicare primarily serves individuals age 65 and older, as well as those with certain disabilities. It's largely age and disability-based, with coverage split into parts, each focusing on different areas like hospital stays, outpatient care, and prescription drugs. On the other hand, Medicaid caters to low-income individuals and families and offers a broader level of health insurance coverage. Eligibility for Medicaid is primarily income and family size based, with criteria varying by state. When it comes to costs, Medicare often requires premiums, deductibles, and co-payments, while Medicaid usually has minimal or no out-of-pocket costs. Funding-wise, Medicare is mainly financed through payroll taxes and beneficiary premiums, while Medicaid is jointly funded by the federal government and states. Enrollment in Medicare is largely automatic at 65, whereas Medicaid requires an application process. Understanding these differences can help you or your loved ones make informed decisions about healthcare coverage.